Hello, ladies and gentlemen. Welcome to Citizens Voice. I am Dr. Nik Nikam along with Bangar Reddy, and we have a very special guest today, Dr. Nisha Shah. She is an eye specialist. She has been in the Sugarland area for 10 years, and she is an expert in cataract and laser surgery. She has been recognized 3 times in the Fort Bend County area. Maybe we'll ask her, about what. And she is a very well-known eye doctor, and she has been on several national television programs and all this. Dr. Nisha Shah, welcome to Citizens Voice.
Thank you.
And
Thanks for having me.
let's tell us about your background and also, your recognition in the Fort Bend County area.
Basically, I'm no one special. I'm an ophthalmologist. I've been practicing in the Houston area for about a decade. And I'm originally from Florida, but I did, to become an ophthalmologist, as you know, it's a lot of years of training. It's 4 years medical school, and then we do a 4-year residency, and then we do another year of subspecialty training after that. So we're actually eye surgeons. And the reason I stress that is a lot of patients get confused. They're like, well, are you an optician? Are you an optometrist? So the words are really confusing, but basically I'm a medical doctor and a surgeon of the eye. And my office is actually in Bel Air, so just 15 minutes away from here, from Sugarland. I own my practice. It's called Ophthalmology and Cataract Surgeons of Texas, which is a long name, but if you honestly just go to Google and you type in Nisha Shah, ophthalmologist, I pop up and I have one location.
Yeah, it should show up right there on top. Okay, let's start off with very simple eye problems. We are talking to the younger generation. What kind of common eye problems do you see in people like less than 40, 50 years? Then we'll move on to older folks like me.
Yeah, so in the younger population, and when I mean young, I mean like under 40, we see a lot of the typical dry eyes, eye allergies, something called presbyopia, which happens to everybody. That just means after 40, you need to wear glasses to see up close because that muscle gets a little weaker as we age. Dry eye is very common. I think most people have dry eye. It's kind of like saying you have dry skin. So when our skin's dry, we put lotion on it. When our eyes are dry, we use artificial tears over the counter. But those are very common, especially nowadays. People are on the computer so much. And when you hyper focus like that, you actually don't blink as often.
So what happens when somebody is watching 12 to 18 hours like me, a computer monitor or iPad? What are the long-term effects of this?
So, you want to...
Is there a radiation effect also? Maybe we can comment on that.
Yeah, so main things that we want to look out for, especially with kids, is we want to make sure that computer or your phone or whatever you're working on isn't too close to your face. Especially with kids, we want to make sure it's at least an arm's length away and that you're taking frequent breaks. So every 20 minutes, you want to look somewhere far away, at least 20 feet, and give your eye some rest, because otherwise you're squeezing that muscle all day long, and a lot of patients can get like headaches from it. It can cause a lot of eye strain.
I was wondering what was causing my headache this afternoon. Now I got the answer. Okay, is a dark screen better than a bright screen? Does it make any difference?
So the dark screens definitely help with the contrast and the brightness. It's just more of a easier to adapt. We have very weak evidence. There's not a lot of strong evidence yet against the blue light filters, but I say, so what? It's like an extra couple bucks. Add it on your phone, add it on your tablet. Why not?
And some people say that when you hold your phone close to your ears, this effect of radiation and electromagnetic effect and all this. Do we have the same effect on the eyes?
So, the eyes we don't hold the phone that close to the eyes, but I would assume, yes, if there's radiation to the ear, it's some of it is getting near the eye.
I see.
Absolutely.
Yes. That's fascinating. Ladies and gentlemen, we are talking about eye diseases. Dr. Nisha Shah is our guest. The number to call here, Bangar, what's the number people can call?
It is 281-277-6874.
Yeah.
And you are listening to Dr. Nisha Shah, ophthalmologist, and we are, the citizens who just joined, we are talking to Dr. Nik Nikam, and my co-host, and again, Dr. Nisha Shah. And I have a question, Dr. Nisha. I would like to ask you. This is for myself too. I'm a little selfish here, being myself wearing glasses. So
oh, you're not giving out your secret on the radio, are you?
What symptoms indicate someone might be developing cataracts?
That's a great question. I'm glad you asked that. Very important question to know, because guess what? We're all going to get cataracts. Me, you, movie stars. There's nothing we can do to prevent it. So let's talk about first what a cataract is, and then we'll go over the symptoms. So for those of you listening, a cataract is when your natural lens, so our eye is like a camera.
Yes.
And when we're born, when we're babies, that lens is crystal clear. And as we get older, usually when our hair turns gray, our lens is turning gray, usually it's like a yellowish orange color. That's when a cataract is forming, okay? And you'll notice, hey, I went to, my optometrist or my optician for my annual, at the mall, and they can't get me better than 20/20. Like my vision is getting more blurry. That's a sign of a cataract. You'll notice constant haziness that doesn't get better with blinking. Glare, especially when driving at night. So a lot of patients say, hey, I used to drive a lot at night, and now when I do, it really bothers me.
Yes.
The glare from the oncoming traffic is bothersome. I can't see. All those are signs of a cataract. So if you're noticing that, you need to call an ophthalmologist. We'll take a look. We'll dilate you. We'll look at your cataract. Don't be afraid to see an ophthalmologist, because just because you come and see me doesn't mean I'm going to do surgery on you.
Yeah.
Your cataract has to meet certain criteria. Your vision has to be, worse than 20/40. The cataract has to mature enough, or what I say is like ripe. It has to be ripe, like a nectarine. You want to take it out when it's ripe. You don't want to wait till it's overripe, because then it actually becomes more difficult to take out. But we also don't want to take it out when it's too soon. So
it looks like somebody must have told you about me, because you're describing all the symptoms I went through. Exactly the same thing, little fuzziness, little blurriness, and it comes on slowly. That's where we don't understand what's going on, why the glasses are not correcting it. Correct. And all this. So you said that it has to be ripe. Are there different stages of cataract, and when do you determine it's time to pull the knife?
Yeah. So to keep it simple, and as a surgeon, I see a cataract as not visually significant or visually significant. So if it's visually significant, meaning you're not able to see those letters on the TV anymore, or it's causing a lot of halos and glare, and then what I'm seeing through the microscope is a certain density of the cataract, then that means it's ripe, it's significant, it's time to take it out.
So what's actually happening inside the lens? I mean, it's supposed to be crystal clear when we are born. So what actually is going on there?
Great question. So it's basically like an accumulation of proteins and buildup, reactive oxygenation, all the free radicals and things that happen normally with aging is happening in our lens.
So once you decide that we need a cataract, is there an alternative treatment?
No, unfortunately not. Maybe one day in 100 years, but right now the only treatment is surgery.
Okay, going back to it, in terms of prevention, is there something that can be done to halt the progression of this, the opacification of the lens?
Yes.
Prolong.
Yes. So definitely diet, exercise. Those are the things, just being overall healthy. We do know what can exacerbate cataracts, and that's diabetes, having high blood pressure, just not being healthy overall. Genetics plays a large part. Exposure to steroids, like IV steroids, if you're in the hospital, oral steroids can exacerbate cataracts. But it's interesting because my patients surprise me. I'll see, 80-year-olds that don't have cataracts yet. And then my mom, who's a marathon runner with no medical history, got it at 59. So everyone's
so you can't
different.
Really pinpoint as to what's going to happen.
Yeah.
So once you identify, somebody has a cataract, what are the steps that are taken to see, if they need lens, and what kind of lens they need, and what kind of procedure they need? And maybe you can walk us through the cataract procedure for the general public.
Sure. So cataract surgery, the last, especially 5 years, the technology has just exploded.
Definitely it's not as difficult as eye surgery.
No.
Eye doctor here. So.
He wants to pick on me. I said, hey, heart is the most important. Everything is important, but heart is a very complex one.
The goal of the heart is to supply blood to the eyes.
So why I'm saying is, my listeners, I want to say that
I know.
cataract surgery, you should not say that your life is up and down, ups and downs. So I want to start from there. It's they go to the regular visits, and you come across this, and you treat patients. So
Correct.
let's know what the steps the patient should follow.
Absolutely. So let's
Yeah.
talk a little bit about cataract surgery, then we'll get
Yeah.
into the really fun stuff.
Yes.
So overall, no one should be afraid of cataract surgery. Okay, we're all going to get it. At
I have
some
gone
point.
through twice, so both
exactly
eyes.
for both eyes. So the whole surgery is about 15-20 minutes. It's done under light sedation, so anesthesia will be there. They'll give you some medicine through your IV. It's kind of like having a colonoscopy.
Yeah.
So you're relaxed, you kind of take a nap, you're breathing on your own. You know, we go in, we take the cataract out, we replace it with a new lens, and then I like to put a patch over my patient's eye and then see them usually like the next morning, and then I'll take the patch off, and then I tell patients it takes a few days for everything to start clearing up because we put some medicine into the eye. But it's an in and out process.
Do you
the whole
put
thing
any
takes 2 hours.
stitches?
It depends. Usually no,
Yeah.
unless patients absolutely need it. But no, now everything is, we can do bladeless, stitchless surgery
I see.
with all the new advancements now.
Oh, tell me about bladeless.
Yeah.
What is this?
So now we use laser technology to do
Uh-huh.
certain parts of the cataract surgery for us.
I see.
So the lasers will make our tiny little incisions at precise locations. It'll also make relaxing incisions to correct astigmatism.
Yeah.
It'll create a perfect circle for that lens to go into. It'll also fragment the cataract into perfect little pieces. And then that way, when we're going in with the ultrasound and like sucking it out, we're using less energy because the laser has already fragmented the lens. So the laser does a lot of cool things.
When you insert this lens inside the eyes, what holds it in place?
That's a good question. So it slides in kind of like a little, think of it as like a little rotli, like a little taco that's rolled up. And when it rolls in, the lens, which is shaped like a circle, has 2 little arms. We call them haptics. And they kind of go in and stabilize, and they stay there.
They stay there.
That's why I tell patients after surgery, for 1 week, take it easy. You can walk, cook, drive if you can, but no like upside down yoga, no Bangar dancing, none of that up and down jumping, because I don't want that lens to move. After a week, you can resume all normal activities.
Basically, don't put pressure, but you can be stand still and
yes, we don't want that lens to jiggle. It takes like a week to get stuck.
Okay,
in a good
if
way.
somebody has pre-existing eye conditions like near vision or far vision or astigmatism and all this, do you take care of all those things during the surgery, or maybe you can expand on that?
So
one?
cataract surgery will reset your vision.
Yeah.
So it'll correct your using the lasers, we can correct your astigmatism. And now they have new lenses invented called multifocals, where you can see far away and intermediate and up close without having to rely on glasses. So that's what we put in my dad. So he watches TV, reads the newspaper. What did you get? What kind
Okay, that's a good question. I was talking to my eye doctor, and one of the things they said was one of the strange things that you may experience is this star-like flashy effects from the traffic lights, especially in the nighttime, if you get this multifocal lens, because it adjusts to 3 different locations. And, whether you put the lens in physically or not, mentally, when you put that thought in my mind, I don't know if I can ever get it out. So I got just single focus lens.
Which is also an excellent lens. So the lens, the technology definitely has evolved. So now I'm finding less complaints of glare and halo. So like my dad has the first generation lens from 3 years ago. Now it's very rare to see those side effects.
Looks like we got an eye question here, so let's get it.
But of course, you have to be a candidate for that kind of lens. So you can't have any retina issues.
You're on Citizens Voice and Masala Radio.
Shakti is calling. He has a very important topic going on for the cataract.
Yes.
I'd like to have one question. The doctor would explore it.
Yes, go ahead.
During the if the person has a Medicare, what kind of lenses would they give, or what is the choices they could have?
Oh, in fact, you read my mind. That was the next question I was going to ask Dr. Nisha Shah, who is our guest.
Yeah, go ahead.
Yeah, that's
but repeat the question.
Okay, basically, I think he had a very, very good question. When somebody has Medicare and you're talking about all these different lenses, is there a cost involved, and how do we decide, what is the best lens for a Medicare patient? if they are on a budget. I mean,
Right,
most patients on Medicare or budget.
So unfortunately, insurance does not cover these premium lenses. Insurance will cover what we call a monofocal lens, meaning it can be only aimed for distance or aimed for near. So the premium price, the premium lenses do have the premium price. Your surgeon, the facility anesthesia, they get paid by Medicare. And then, these are what we call add-on packages.
Yes.
Yeah. Like laser, correcting astigmatism, that's an add-on package. Lenses are an add-on package. But the way I see it is it's your vision and it's worth it, especially since glasses are expensive.
I know it costs like $250 to get a bifocal or variable focal lens.
Some patients pay $1,000 for progressives.
No, I go to cheap place like Walmart.
Cost on the line. Question is,
okay.
When they come to you,
premium lens, how much is good?
Okay, we're coming to that next question. Yes. Okay, you can hang up and listen. So, okay, tell us, is there an extra cost involved with these premium lenses? You said laser is separate and all these things. This is a major question for every person, especially Medicare population.
So, average premium lens cost just depends. Usually, it's around an extra $2,000 to $3,000 per lens per eye.
Yeah.
Yes. And then laser is an additional. Yeah. So sometimes it can go up to $4,000 to $5,000 per eye with everything if you want the whole enchilada. Yeah, but it's really important because
so that is not covered, right?
No, that's not covered.
Yeah, so basically the point is here, if you want that lens and with including the everything is coming around 5K. But I think can they come and get the estimates from you, like how much Medicaid is covered?
Yeah, absolutely. Absolutely.
I think for you, I think the best thing is reach out to Nisha Shah and get their opinion, right?
Yeah.
Get this list. Right?
Maybe you can give out your address. She's right there in Bel Air, Texas.
Yes. If you Google Nisha Shah ophthalmology, there's one location in Bel Air. I'm there every day, and that's me.
Oh, that's good. How many doctors work at your
Just
clinic?
me.
Oh, just me. Oh, that's
Yes.
wonderful.
Thank you so much for
Any other questions, Mr. Daniel? Okay.
Appreciate you.
Okay, let's continue on the same cataract. And once we have the surgery and we're done, are we done for good, or do we have to come back for follow-up?
So once you get cataract surgery, you're done. That cataract's not coming back. Sometimes behind that acrylic or the artificial lens that we place in your eye, it can get foggy. That's called a secondary cataract. That's treated with a laser. Very quick procedure, 100% covered by insurance. Takes a couple minutes. It's not a real surgery. It's like it's a surgery, but it's not like you don't even have to be fasting or anything. You just show up. We clean out the back of that. But I get asked that a lot by patients. Like, is my cataract going to come back? Technically, no. But sometimes we call it a secondary cataract, but it's just the lens getting cloudy. The implant.
And also, can we get into this Lasik? Basically, I want to say.
Everyone likes to learn about LASIK.
I don't want glasses like this. I don't want glasses, nowadays. But what is the age is the best for going with LASIK? How do you make a decision?
Yeah, so I'm a Navy trained LASIK surgeon, and I had LASIK done on my own eyes, and it is absolutely life changing. But the ideal age for LASIK really is between 25 and 35. So 25 is when your glasses prescription stabilizes. And that's a good age to come in. I do free LASIK consults. Yes, I do free LASIK consults. So if you don't know if you're a candidate or your daughter, or you have a relative who wants to come in, we'll take a look. Now, past 40, there is something called monovision LASIK, which is where we aim one eye for distance and one eye for near.
How does it work? I mean, does it?
Your brain gets used to it.
Huh?
Your brain.
What if you go for wait a minute? What if you go for a driver's exam and say, well, one eye is skewed, the other one is to the other side?
But that's okay because they check you with both eyes open.
I see. Okay, I just want to make sure that they're not going to deny my driver's license.
So monovision, we
always have you try adaptation time required?
Right, that's a great question. So we always want to make sure before we do monovision LASIK that you're going to tolerate it and that you're going to absolutely love it. Yeah. And people either love it or they hate it. And to really know for sure, we do a trial of contact lens.
Yeah,
so I say, here's a trial of contact lens, wear it for 2 weeks, and then give me a call. And patients surprise me, because I hate it. It throws off their depth perception. Why I said it, because but my mom loved it, for example. So my mom's monovision, and she's a tennis player, and
See, like most people our Indian population who are listening to this, they are all computer geeks. I mean, they are IT professionals. They are glued to the computer 18 hours a day,
Right.
and I wonder how that interacts with what we are talking about.
Yeah, so and then they have something called mini monovision, which is where we could do one eye for distance and one eye for intermediate. But I guess the take home message here is every patient is different. And actually, before I do cataract surgery on anybody, I have them fill out this questionnaire where I really get to know you. Like, what hobbies do you have? What kind of work do you do? I get airline pilots who come see me.
I see.
And I don't recommend, a lot of times I don't recommend the multifocals for them because I want them to have really good distance vision. It all kind of depends.
I want to give my own personal experience, and I mean, I have been wearing eyeglasses since I was in medical school for distant vision. All right, when they said, "Oh, you're getting too old, you need to get your cataract out," then I went through the cataract surgery. Of course, I told you I had a mono lens with for 18 inches from this one. So most of the day, I don't need to wear the glasses.
Right.
Like if I'm cooking or doing dishes, or I got to do dishes too. That's why. I just wanted to make sure I'm telling you. And I'm on the computer 10 to 12 hours a day because I do online work. And the only time I need is like if I go to, if I go to a party or if I am driving. That's the only time I need it. And I haven't seen those glares which they were talking about with multifocal lenses.
How long ago was it, if you don't mind sharing?
Oh, this was like a couple of years ago.
Okay. Yeah. A lot has happened even in a couple of years. Yeah. So the thing I love is I'm not loyal to a certain company like Alcon, Johnson & Johnson. The lenses are like cars. So 1 year Mercedes is the car of the year, the next year it's a BMW, and then they all try to one up each other. So same thing with the lenses.
Well, it's like a spouse, if it fits you, it fits. Otherwise, it doesn't work.
Yeah, but the lens technology is just getting incredible. It's evolving.
Now I have another very important topic for the Indian population. Of course, majority of them heart disease. 50% of the Indians have diabetes, which can creep up in the 40s and 50s. And maybe you can talk about the importance of eye examination, eye care among diabetics.
Yes. So if you are over 40 and you have diabetes, you have, or if you're over 40 in general, which we'll get to, like how do you know when to see an ophthalmologist? But every single diabetic has got to get a dilated eye exam every year. That is so important.
Is that right?
Because we can screen for things and pick up things earlier than you can notice it. So sometimes we pick up diabetic retinopathy, and then we have to call the PCP and say, hey, we need to adjust the insulin dose or your metformin. Very, very important. If you have diabetes and you are experiencing blurry vision, you absolutely need to see an ophthalmologist because there is something medically or surgical that needs intervention. And the sooner that you get seen, the better. And that can actually prevent you from permanent blindness.
So if there's a good control of diabetes, does it help to prevent like eye complications or maybe reverse? Does it reverse?
Yes. So you definitely want to keep that A1C, lower than 6.5. And yes, you can have uncontrolled diabetes. And then if you get your sugars and everything back under control, we see that the diabetes starts clearing up. Now, a lot of times, just depending on how bad the retinopathy is, you will need some surgical intervention, injections, lasers to help reduce the issues that are going on in your retina.
It may be a lot easier to cut down eating carbohydrates and keep the sugar level down.
Yeah.
I mean, that's far better than, any other alternative, especially, eye complications. They are so complex.
Yeah, that's very important, especially diabetic patients. You explained it so well. And so you talked about LASIK surgery, you talked about diabetic, and you also talked about the cataract. So tell me about your working hours and how they can reach out to you. I know.
And your phone number if you want to give out.
Sure.
So they can Google your name, Dr.
Nisha Shah.
Nisha Shah, ophthalmologist, and they get it. So you all can leverage. You all can reach out, and especially. I think the Indian American communities, most of them are tended to be prone to be diabetic.
Right.
And so I think that's an important thing that people need to observe.
And we're seeing a lot of glaucoma
Plus,
too.
she as an Indian, you always feel comfortable with Indian doctors. Plus, she can speak
Gujarati,
she can speak Hindi, she can speak English,
Urdu, English,
so
Spanish.
English,
Figure out if there's a different language.
Okay,
mhm.
one more topic. Let's cover that glaucoma. What is glaucoma?
Yeah, so glaucoma is a disease where your optic nerve slowly starts dying,
Ooh.
just to put it bluntly. And one of the things that helps reduce the progression of glaucoma is keeping your eye pressure low. But glaucoma is so scary because you can
Yeah.
have glaucoma and you won't even know it because it is painless. And it's slow. It's the symptoms really is tunnel vision. You start to develop
Oh, I
tunnel
see.
vision,
Yeah.
and it's permanent, and the damage is irreversible.
Hmm.
So every
Well,
single
what
patient,
kind of patients are prone for this?
yeah. So, smokers, if you smoke, definitely want to stop smoking right away. Diabetics, that's a risk factor. There's studies now saying that if you have a very high minus glasses prescription, like high
Mhm.
myopia,
Yeah.
that's a risk factor. A lot of it is genetic. So if your mom or your dad has glaucoma, it doesn't matter even if you're 20 years old, you definitely want to come in for a baseline evaluation. Indian people were finding a lot of glaucoma suspects. So
Hmm.
every patient that comes into my office, if their nerves look suspicious, I'm screening you for glaucoma. I'm doing
Yeah.
a scan. It's like almost like an MRI of, it's like a fancy ultrasound of
I
your
see.
optic nerve to get measurements. Look for thinning. We're checking your pressure. If you are listening at home and you have a diagnosis of glaucoma, or if you're a glaucoma suspect, you absolutely want to see a eye surgeon because glaucoma is actually a surgical management. I mean, you're probably on eye drops, but now we have lasers. It's called SLT. Very low. It's not invasive. It's non-invasive laser therapy that can help reduce your eye pressure. And the beauty is, if you have glaucoma while cataracts at the same time, we can actually do a micro stent. It's called
I see.
minimally invasive glaucoma surgery, which I do to help lower your pressure even more during cataract surgery. So, go see the experts.
Dr.
Yeah.
Nisha Shah, it's been
Mhm.
so fascinating. I couldn't even imagine we already passed 30 minutes. So, man, we're going to need a whole hour to,
We definitely need more time.
Yeah.
Want
We-
you to come more number of times.
yeah,
Yeah,
we
this
would
was
like
great.
to have you come back because this is very important topic, especially for the Indian population because of
Mhm.
the history of high cholesterol and also history of diabetes,
Right.
and practically just about every
And most
person.
importantly, we need to take care of our eyes. Especially,
Yeah.
especially most of them are IT professionals here.
That's right. Yeah, that's why I said.
Doctors,
Mhm.
engineers,
Yeah.
and highly paid. So we need to
Right.
take
And
care
I
of
take
our
all the
eyes.
entrances, PPO, HMO.
Yeah.
A lot of these IT jobs, your employers offer excellent insurance.
Let's give out your contact information and phone number,
Sure.
and maybe we'll have you
Yeah,
come back
yeah.
in.
So-
in
So
And
the
the
phone,
website.
sure. So website is easy. It's idrshaw.com. That's EYEDRSHAH.com. And then my phone number is kind of tricky. It's 832-499-9722. But honestly, if you just remember Nisha Shah, ophthalmologist, it's probably easier
That's
that
right.
way.
Absolutely. Yeah. Google
and
find
and
out.
you'll find my website, and I have just one phone number.
And I would suggest those who are listening, if you have these symptoms that we talked, and reach out to her, get an appointment, go there and get it diagnosed, and then get it cost, how much it's going to cost, and they can look into the insurance and see
Mhm.
how much it is going to cost, and accordingly you can make a further decision on what needs to be done.
Of course, we didn't talk about glasses and all this. I'm
Mhm.
sure you cover that also.
Yeah.
Okay, thank you
Yeah.
so much, Dr. Nisha Shah. Ladies and
Thank
gentlemen, you
you.
have been listening to the Citizen's Voice. This is Dr. Nik Nikam along with Bangar Reddy, and our special guest in the last half hour has been Dr. Nisha Shah, who is an eye specialist. She is located right in Bel Air, Texas. You can reach out to her, and we will be back next Sunday, and we will have another segment of a Citizen's Voice. Until then, bye from Bangar Reddy and myself and Dr. Nisha Shah.
Thank you.
Thank you, Dr. Nisha. Thanks for coming.